I'm David Haynes. I'm the opinions editor at the Milwaukee Journal-Sentinel. Welcome to Fourth and State. I'm joined today by Kitty Rhoades, who is the Secretary for the State Department of Health Services, and we're going to talk for a few minutes about the rollout of Obamacare, the Affordable Care Act, in Wisconsin. Secretary Rhoades, welcome.
Good morning. Thank you.
Thanks
we
for being
appreciate
here.
the opportunity. We
Sure.
want to get our word out to as many people as possible.
Well, let's start with sort of what is the main message that you want to get out to the citizens at this point about the ACA?
Well, in the state of Wisconsin, we have a unique opportunity here. We have developed a mission statement as to what we wanted to accomplish when we would implement the Affordable Health Care Act. And number one, we wanted to ensure that every resident would have access to health insurance. We wanted to provide the opportunity for people to get out of programs that limited their earning. We have many people in Medicaid who didn't want to take additional hours at work or a promotion because if I earn more, I'll lose my benefits. We also wanted to ensure that our Medicaid program would be sustainable into the future and that we would have a safety net for those who are truly most in need. So we will be transitioning many of the members who had been in Badger Care or individuals in Medicaid who were over 100% into the federal marketplace or the exchange, where their earnings then do not influence their benefits.
About how many people is that, do you suspect?
Totaling about 180, I think, 180,000. It's challenging to determine those numbers.
Sure.
We will then be bringing in individuals, childless adults who are below 100% of federal poverty level into a full health insurance program. Before, members who were childless adults had opportunities for the core plan, but it had very limited coverage. This will provide, the traditional health as well as mental health, dental health, vision. So it is giving a great opportunity. So our job is to reach out to all of these individuals and make sure that they have the information that they need to be able to make the decisions about their health care starting October 1st.
And October 1st is a key date, but that's not when the insurance starts.
Correct.
So walk our viewers
October
through
1st
what those
starts
dates are.
the enrollment process.
Okay.
The insurance industry or the Affordable Health Care Act does not come into play until January 1st of 2014. But it is important because when you sign up does make a difference as to when your coverage will go into place. So people think that if they, October 1, the whole insurance world is going to change, and that's not it. It's the beginning of the enrollment centers. So we really looked around and said, okay, what have we learned about trying to market big change or new programs in a statewide plan that's as confusing as this? We watched other efforts that had been put forward, for example, Medicare Part D. The federal government spent a lot of money advertising and marketing, but yet we found that when people really needed the information, they tended to get it from their local pharmacist. They go to people that they trust or people that they have with whom they have a relationship. A message being saying, hi, I'm government and I'm here to tell you what's best for you is not usually accepted very well. So we looked at what systems work. We found a great example right here in Milwaukee with the Milwaukee Healthcare Partnership, a grassroots movement of reaching out to people based on their relationship with them. And so we said, this seems to be the best model, working together, but we need to acknowledge that what works in one part of the state will not work in another part of the state. Superior is going to have a different arrangement than Beloit. So we've established enrollment regions, which tend to match or mirror our income maintenance regions, and say, all right, meeting in these geographical areas, we meet with libraries, churches, social organizations, county people, the pharmacists, the drugstore. How can we utilize you to help reach out to these people?
So try to use people on the ground that people know and trust to get the word out.
Familiar with you.
Now that enrollment window is somewhat limited, right? I mean, it starts October 1 and ends March 1st, I believe, of next year. Is that correct?
And that's first year only.
First year only, okay.
And in the full-blown implementation, if you miss the open enrollment, you're out for a year.
Right.
In this first year, because they're understanding people are going to take a while to grasp it. If you sign up through the open enrollment period from now till January 1st, December 31st, your coverage will start in January. If you miss it and sign up somewhere between January and the end of March, your coverage then is not retroactive, but postponed by 1 month from the time that you do sign up.
But if you end up missing that March date,
Then
you are out of luck until the
Right.
next October. Okay, so an important point for people
It's
to
an
understand.
important point, which is why we need so much help saying, we need people to understand you have to do this now.
Now let me ask you a political question. Governor Walker did not support the ACA. Many Republicans did not. And he did not want to build the exchange in Wisconsin, let the federal government do that. There's been some skepticism about your department, about how you would handle the enrollment. Respond to that criticism.
It's the law of the land.
Okay.
And we're here, as with all other federal programs, to help ensure that our people have the information and the access that they need. We're done with the political statement now. It's about the law of the land. We do this, and we do it well.
Well, Kitty Rhoades, thanks so much for being with us
Thank
on
you.
4th and State.
Thank you.